as many of you know, Pfizer and Moderna are the two companies that have produced two separate vaccines that have been used to help vaccinate the population against COVID. But it's important to know when we're talking about these vaccines, what exactly they are, what they're made of, and what we can expect moving forward in terms of effects and effectiveness. So today we'll be discussing four main topics. Number one, of course, Moderna and Pfizer's vaccines. Number two, we'll discuss the CDC's facts as to what the COVID vaccines are, how they work, and what we can expect about them. Number three, what about these new strains? Some of you have may heard that there are new mutated or different variants of COVID-19. Are these strains going to impact vaccines? Will the vaccines be affected by them? And then, of course, the side effects of the vaccines versus COVID-19. We're all weighing this balance. Should we get the vaccine and risk having side effects from the vaccine, or should we risk getting COVID? And what are the long-term consequences of both? So thank you both for joining, and let's go ahead and get started. So Pfizer's COVID vaccine was again produced over the past year in 2020. The color of the vaccine itself is white to off-white. So when you see it in the vial, that's how it looks. I listed the ingredients here. Some of them are quite interesting to try and pronounce. The key here is that some of you may have heard people may have allergic reactions to Pfizer's vaccine. This is because in part, one or more of these ingredients cause that allergic reaction. So it's important to note, particularly potassium chloride, potassium phosphate, sodium chloride. These are all things that people may be allergic to or may produce a reaction in individuals who get the vaccine. So this list, and again, this presentation is going to be recorded, so you can have this list. And I got this list from Pfizer's filing with the FDA. When they actually filed their request for emergency use, they included this ingredient list for their vaccine. So what else do we know about Pfizer's vaccine? Well, we know that it is a vaccine that needs to be taken in two separate doses. So the vaccine itself is administered intramuscularly. What that means is it's just a shot in the muscle, like the flu vaccine, like other vaccines. And it's given in a series of two parts, 21 days apart. And that's important to note because that's different from Moderna's vaccine. So Pfizer's vaccine, you take 3 weeks apart. So if you got your first shot on January 1st, your second shot would be tomorrow, January 22nd. And one of the things I wanted to note is this is taken from Pfizer's study itself and its filing with the FDA. It was shown that the Pfizer vaccine was effective in producing an antibody that actually reduced the amount of instance of COVID-19 1 week after the second dose of the vaccine, showing a 95% vaccine effectiveness, with 8 people in the vaccine group being infected with COVID compared to 162 people who didn't receive the vaccine being infected with COVID. So who are these people we're talking about in this study? The study itself was 38,000 people, and they had to be over the age of 16. There is a separate vaccine being produced for individuals who are under the age of 16, a child vaccine. It takes a little bit longer for those vaccine trials to commence and complete. But these were some of the side effects that Pfizer reported in their FDA filing. Most common, injection site reaction. What does this mean? Sometimes there's pain, there could be inflammation, there could be a rash or a little bit of redness where you get your shot. We see this with the flu vaccine and other vaccines as well. 62% of people reported fatigue after getting their first or second dose. 55% of people reported headache, 38% of people reported muscle pain, 31% of people reported chills, 23% of people reported joint pain, and 14% of people actually did report fever. Now, severe adverse reactions, what do these even mean? This is a case in which an individual has a serious reaction, either that requires hospitalization, it could potentially be life-threatening, and it's serious enough to warrant its own category. So for severe adverse reactions, approximately 0 to 4.6% of participants had a very severe reaction. And it's worth noting that this was more common after the second dose of Pfizer's vaccine. So after they got their first dose, 21 days later, they got their second dose. It was more common to have a severe adverse reaction after the second dose, according to Pfizer. Now, in comparison, Moderna's vaccine, color, exactly the same color, similar white to off-white, so it'd be hard for you to distinguish with the naked eye which vaccine is which. The ingredients, though, are different. While both use lipids, both use cholesterol, you can see the ingredient list for Moderna is actually quite different than Pfizer's vaccine. And this has produced a little bit of a distinction in results as well, and we'll talk about that moving forward. But the important point to note is that if people have reactions to the vaccine, it is typically a reaction to this ingredient list, something in this list, one or two ingredients. So if you have any allergies or pre-existing conditions that maybe be averse or may not be appropriate for you, please contact your doctor. Please talk to your doctor about the vaccine prior to getting it. So what about Moderna's trial? Or what about Moderna's vaccine? The vaccine, just like COVID, just like the Pfizer vaccine, is administered in 2 dosages. This time, however, Moderna's vaccine is actually taken 28 days apart. So Pfizer's is 21 days apart. The second dose of Moderna is 28 days or 14 or 4 weeks apart. And what about the data should we know? The data showed for Moderna's trial that it had an effectiveness. Oh, sorry, I think someone's talking. There was actually an effectiveness of 94%, around 94%, with 11 COVID cases being reported in the. I'll unmute myself, and 185 cases in the placebo or non-vaccine group. What were the safety results? So these were from 27,000 participants, again, over the age of 16. Again, we see injection site pain. We saw fatigue in 68% of individuals, headache in 63%, muscle pain in 59%, joint pain reported in 44%, chills reported in 43%. The key distinction, there are 2. Severe adverse reactions were 0.2 to 9.7%, so more common to have severe adverse reactions in Moderna's vaccine than in Pfizer's vaccine, and again, more frequently after the second dose. But one distinction I would like to make here is Moderna did not report in their FDA filing that there was fever as a common side effect in their vaccine. If you remember, Pfizer's vaccine produced fever in 14.2% of recipients. So that may be something to consider as well. Here's just a quick screenshot of the key differences. So again, Pfizer's vaccine, 3 weeks apart. Moderna's vaccine, 28 days or 4 weeks apart. Both, you have to be 16 years and older to take. Again, a separate vaccine is being developed for younger individuals. Where is the vaccine being manufactured? This was a question that we got. And originally for Pfizer, there were 2 plants making the vaccine. One was in Kalamazoo, Michigan. Another was in Belgium. For Moderna, the original plants were started here in the United States. One was in Massachusetts. The other was in New Hampshire. How are they being basically distributed worldwide? Pfizer, they were shipped via UPS and FedEx. For Moderna, it was started as being shipped by McKesson. And one of the key distinctions that I did want to make, and something that many of you may already know, the way in which the vaccines are stored is also different. Pfizer's vaccine needs to be stored at minus 70 degrees Celsius, which is around minus 94 degrees Fahrenheit, far below freezing temperatures, versus Moderna needs to be stored at minus 20 degrees Celsius or minus 4 degrees Fahrenheit, so 90 degrees Fahrenheit hotter than Pfizer. So you can see how Moderna may be easier to transport and may be easier to maintain and to store because it doesn't need to be at as cold a temperature as Pfizer. Now, I know this is all important, and those are the basics of the vaccines. But what does the CDC say about the vaccines themselves? These are some questions that were posed to the CDC that we've also been posed and that we wanted to discuss. So number 1, do the vaccines give you COVID-19? Will you get the vaccine and get COVID-19? According to the CDC, none of the vaccines currently in development contain the live virus. They contain a weakened or dead version of the virus that would not allow individuals to get COVID-19 simply from being injected. However, that doesn't mean that you won't have any side effects. As we talked about, there are symptoms that can be produced, like fever. So the vaccines will not give you COVID-19. They don't have a live version of the virus. but you may get some symptoms similar to COVID-19. Another question they asked is, if you get the vaccine, will you test positive on the COVID-19 test that we're all currently taking? The answer is, according to the CDC, none of the vaccines that are currently being produced will cause you to test positive on a viral test. And I want to make this distinction. A viral test is what we're all taking. The PCR test, they test the viral load in you if you've been infected with COVID-19. That is different from an antibody test. The antibody test that people are taking determines whether or not your body has produced the antibodies to fight off COVID-19. And the vaccine may cause you to test positive on the antibody test, but it should not cause you to test positive on the viral tests. And again, this is something that the CDC is still working out, but I wanted to make that distinction clear. Some other facts posited by the CDC. So if you've gotten sick with COVID-19, should you still get the vaccine or not? According to the CDC, even if you've gotten COVID-19 and you've fully recovered, you can still become reinfected with COVID-19. And there are two key things to think about. Number one, experts don't know how long after you've had COVID-19, how long are you still protected by the antibodies that you've built up? Is it months? Is it years? Experts don't know. So you could still benefit from getting the vaccine. And number two, if the vaccine produces antibodies that reduce your symptoms, it is important to note, we don't know quite clearly the long-term effects of COVID-19. We are starting to see some research about the long-term effects of COVID-19, but health-wise, having reinfection could cause you to develop more severe symptoms. So yes, even if you've gotten COVID-19 in the past and recovered, you can still benefit from getting the vaccine according to the CDC. And the last point I wanted to make is, will getting the vaccine actually prevent you from getting sick with COVID-19? And again, the CDC says yes. While most people do only have a mild illness with COVID-19, others may get severe illnesses, as we've seen. And there's no way to really tell who's going to be having a severe reaction and who's going to have a more mild reaction. So if you get sick, you could still spread the disease to your friends, family, and other individuals. And creating antibodies in yourself by getting the vaccine can help you, one, prevent getting serious symptoms and seriously ill with COVID, and it can prevent you from spreading it to your friends and family. So these are all the facts that the CDC has included. I've added links in the notes of this presentation, which we'll be happy to share with you as well. This is what we started seeing recently in the news in the past month. Will COVID-19 mutate? And the quick and easy answer is yes. It's already mutated several times. There are 7 major mutations that it's gone over, and today I'll talk about 3 of them briefly. And when we say mutation, we say strain, what exactly are we talking about? What is the point? So this was actually published by OSF Healthcare on one of their blog sites, and I think it's a good example of what these strains and how mutation works. So viruses, as we know, they rely on hosts, either animals, humans, to survive. They invade us, they bind with our cells, and allow the copying of their own cells so that they can spread in the person or animal. Our cells then read the new code that the virus has inserted into them, and we reproduce it like we reproduce all of our cells. So we make more of the virus. That new virus that is now infected us leaves one cell and goes to another and looks to try and, again, keep reproducing itself. So when that happens, when the virus leaves one cell and goes to another and reproduces, the genetic code, RNA, sometimes gets translated, well, it always gets translated into proteins. And when that happens, part of that code can get changed. A letter can be off, and that is what produces these different mutations. And according to most health experts, mutations in viruses, they happen frequently. But what is the key distinction between a serious mutation or a serious difference and one that just happens because of a distinction? Well, according to Dr. Casper at OSF Healthcare, most of these differences occur and they're not really important. They don't change the foundation of the virus. They don't change the behavior of the virus. These smaller changes where there's just a change in the genetic code in the genes of the virus are called, by health experts, drift, where just because the protein, the code changes, doesn't mean the virus is going to act differently, and it doesn't mean our immune system is going to respond differently. What is more concerning, according to health experts and Dr. Casper, is a shift when there's a serious change in the way a virus is created, is replicated, because of the change in its genetic code. So if a virus changes enough, we may not be able to detect it with existing tests. We may not be able to fight it off the same way with our immune system, and medications and treatments that had previously worked may not work in the future. So this is just a key distinction I want to make. Now, how does this result, or how does this relate to COVID-19? Some of you have already seen that there are new strains of COVID-19, and they've come across in different countries. I'm going to go over the three main ones that I want to talk about today. Number one is the United Kingdom strain. So in December of 2020, the World Health Organization announced that there was a new strain in the UK. It was first found in Kent in Southeast England in September. But then by December, it had already spread to London. And because infections had gone through an entirely new surge, it was estimated to be 70% more transmissible than the old strain, or the strain that we are currently dealing with as the dominant strain here in the US. So because of that, the UK had to go on a nationwide lockdown. They had to cancel a lot of their plans for the holiday. And because of that, the CDC now believes that this strain, this UK strain, will become the dominant strain in the United States by March of this year. So we do expect this strain to become the dominant strain, or a very significant strain in the United States by March, and it's already here. We've already tested people, and they already have shown to have this strain of COVID-19. The South African strain, 4 days after the UK announced their strain, South Africa found a new strain as well. Now, it's important to note this strain, the South African strain, is also present in the United States. It is actually surging through California now, and it's infected around 12 other states, more states to come. So this strain is also present in the United States, and it does share similar differences in the genetic code that the UK strain does. However, I want to make one point clear. It is expected that the vaccines may still have a response and may be able to neutralize part of the strain. And I'll talk about that briefly. The last strain I wanted to talk about is the Danish strain, or the Denmark mink strain. So according to experts last year, mink in Denmark has a big mink farming population. The mink actually were developing a new version of COVID-19, a new strain, and this version was expected to be able to be transmitted from the mink back to humans. The Danish government didn't know how infectious it was. They didn't know how this new infection, this new strain, would affect the effectiveness of the vaccines. So as a result, they killed 17 million mink in the Danish farms because of the fear that this would spread and that it wouldn't be able to be attenuated, or it wouldn't be able to be addressed by the new vaccine. There is some good news, and this goes back to the variant that we saw in South Africa. This is the publication that Pfizer is putting forth that found that their vaccine, one of their vaccines, or their COVID vaccine, actually was able to neutralize the South African strain, and there weren't any issues in if their vaccine was able to actually reduce the transmissibility and reduce the symptoms produced by the new strain. So this is good. This means that the new strain can still be affected by the vaccine. At least this is Pfizer's research. Moderna has not put forth the same research yet. And this is still in preprint, which means it still has to go through the processes of peer review. So what is the point of all this? Why are we talking about this? Well, we're all doing this cost-benefit analysis. We want to weigh the effects of the vaccine, and some of us have different opinions about the vaccine, versus COVID-19. So what better way to do that than to look at them side by side? So here on the left-hand side, you can see these are the most commonly reported symptoms of the vaccine. So again, the injection site reactions or pain, fatigue, headache, muscle pain, chills, joint pain, and fever. Here are the short-term consequences of being infected with COVID-19 that we know of. So fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, very common, sore throat, congestion, nausea, vomiting, or diarrhea. So these are the short-term consequences that we know of with COVID-19. However, some research has been posited that it actually has explored long-term consequences of COVID-19. And this would be something to consider again, if you're worried about getting the vaccine, or if you're not sure what the possible complications related to COVID-19 are. Again, the same short-term consequences for the vaccine, but here are the long-term consequences that we have seen with COVID-19. Individuals that we call long haulers, or people who have long-term consequences of COVID-19, either 6 months or a year after infection, still may have fatigue, shortness of breath, cough, joint pain, chest pain, difficulty with thinking, sometimes referred to as brain fog, depression, muscle pain, headache, fever, and fast beating or pounding heart, as many of us know as heart palpitations. But there are also more serious side effects that can affect anywhere from 5 to 10% of individuals who have serious complications related to COVID-19. So those include inflammation of the heart muscle, also called myocarditis, lung function issues, also called pulmonary fibrosis or scarring of the lung tissue. You could have some renal issues or kidney issues. Some people have reported losing their hair, having rashes. Some people have continued to have loss of smell and taste even months after being diagnosed with COVID. Also, sleep issues are commonly reported for individuals with long-term consequences. Difficulty with concentration, again, brain fog, and memory problems. And last but not least, of course, psychiatric conditions. More people who have been diagnosed with COVID are being also diagnosed with depression, anxiety, and changes in mood. So I know that this can be a lot to think about, but what do some of these things mean? When we talk about cardiovascular, respiratory, renal, what exactly are we talking about? So this was published in The Lancet, which is a journal based in the UK, in the United Kingdom. This is an example of myocarditis, or the inflammation of the heart, and I've included a link to the actual article. But basically, they're starting to see with people, these long haulers who have these long-term consequences, they could have heart problems. In addition, lung problems. So you can see on the left a more healthy lung, and you can see on the right what are some of the long-term consequences: lung scarring, pulmonary fibrosis. These are issues that, again, for people who have COVID-19 could develop over time. And last but not least, kidney problems. So what happens when people get COVID-19? There are several different ways in which our kidneys are actually filtering out things in our body. And there are several ways in which our kidneys could be affected by COVID-19. Again, another article published in The Lancet from some of the research they've been doing and seeing these long-term injuries and long-term issues with COVID-19 patients. So that's it for me. Any questions or concerns? Please feel free to add them in the chat, or I can take them now if anyone would like to. I think Christina has control. Christina, let me know if anyone raises their hand.
The chat room is open for any questions you guys have. And if you need me to unmute you, just let me know as well.
And again, you could always write down the questions, give it to your administrator, and the account executives from ANX will reach out to you either for doing another call, or we can socially distance and visit your facility. So there is a question from Nicole Smith. Thank you, Nicole, for joining us. The question is, what do you say to people who think the vaccine will give them, oops, my connection.
Yeah, no worries, I got it.
Yeah, go ahead, Justin.
So Nicole, thank you. What do you say to people who think the vaccine will give them COVID if they have symptoms as a result of injection? Yes, Nicole, we did talk about this briefly. So the CDC has put out guidance that yes, some people will get certain symptoms that resemble symptoms to COVID-19, but the vaccines do not give you COVID. They will not produce COVID-19 in you if you get the vaccine, because no vaccine currently being developed is using a live version of the virus. They're all attenuated, weakened, or dead versions of the virus, or just the mRNA. The mRNA vaccines are specifically not using the live virus, so you should not get COVID-19 from the vaccine. But great question. Okay, Mark. What is the difference between antibodies someone gets from being infected versus the antibodies you build from the vaccine? Mark, that's a great question. The idea is that the antibodies are very similar. The reason being your body is producing these antibodies as a result of the virus itself because it believes with the vaccine that it's been infected. So it should produce similar antibodies with the vaccine that it would if you were really infected. So it would be very hard to distinguish or almost impossible to distinguish the antibodies from when you were infected from when the vaccine was administered. But that's another great question. Any other questions? Thank you, Mark, for that. Oh, come on, you guys are being too easy on me. I was expecting some hard ones. Come on now. When will life go back to normal?
That's a hard question.
All right, Nicole Smith, according to the National Institutes of Health, if we get 75% of the population vaccinated, and again, it is up, I completely understand if you are not ready to get the vaccine, if you're on the fence, that is totally normal. And many people are weighing the cost benefit. But according to the National Institute of Health, if we get 75% of the population vaccinated, we could start to go back to pre-pandemic stages. But that's a large number, and it's going to take a while. But so I don't know the time, but if we get 75% of the people to at least have antibodies, we can start to possibly go back. Mark, thank you, Nicole. Mark, great question. How long will the vaccine last? Ideally, the vaccine will continue to last several months, where they don't know how long exactly. I've been trying to look at the research. They expect the vaccine could last for hopefully 1 year, which again would then lower the amount of infectiousness, lower the amount of cases. But Mark, I'm going to look back into that again, and Sherry or Christina or myself will get back to you. Araceli, how does it affect with pre-existing conditions like diabetes, I'm guessing diabetes, CABG? So the vaccine itself, it may, again, produce those similar symptoms of COVID, but there have not been any issues that have been reported with people who have diabetes or other pre-existing conditions. These most serious conditions have been, as you've all seen, allergic reactions, people being allergic to one of the ingredients to the virus or to the vaccine. So that's been one of the more common issues reported. Now, there have been issues with individuals who are over the age of 75. Some of you may have seen that could lead to some serious, that could lead to potentially symptoms if individuals are already frail and over the age of 75, but that is still exceedingly rare. Christina, thank you, from Albin. We just had the first dose yesterday. Does it mean we have lesser chance now of getting the virus compared to those who doesn't have the vaccine at all? Very good question. Ideally, you would still get the second dose of the vaccine. And I want to be clear, if you get the first dose, please get the second dose. But if you have gotten your first dose, you technically should have should start building up the antibodies. Albin, it's really hard for me to answer the question because everyone's immune system is different. So someone who has a healthy immune system would be able to build up the antibodies faster than someone who may be a little bit older or have more complicated issues like Araceli just mentioned. So it's really, if you have pre-existing conditions, if you have a compromised immune system, you may still take time even after your first dose to be able to build up the antibodies. But that's a great question, and I'm going to see if I can do some research on that as well. And Christina, Sherry, can you guys take notes about these questions, because I do want to try to answer them.
Yes, I have it. I think the main thing is, even if after you've gotten the vaccine, make sure you're still wearing your masks and washing your hands and practicing infection safety and control. Right.
Correct. So CDC guidance, NIH guidance, and the California Department of Public Health have all said, even if you get the vaccine, even if you get the second dose, we still have to do social distancing, and we still have to wash hands, and we still have to wear masks. And that's just part of what we're dealing with right now. So everyone, every healthcare provider says, once you are able to get the vaccine, you still have to take the same precautions. Mark, what is the latest on the vaccine shortage? So Mark, I think you're referring to, well, I know what you're referring to. Yes, there is a bit of a shortage of vaccines. There has been an issue with the Moderna vaccine, as many of you may be aware. They're pausing that for now. So what I'll answer your question nationally and then take it to California. So nationally, yes, there has been a bit of a vaccine shortage. So Pfizer, Moderna, they have these plants that I talked about in the US and elsewhere. They're trying to ramp up production to make sure they can meet the demand. Currently, supply doesn't meet demand. You're absolutely right, Mark. But for California in particular, they are finding ways to try and get more people to administer the vaccine. We have quite a few vaccines here in California. What we don't have is a good percentage of individuals who are getting the vaccines, even though we have them in the supply. So they're trying to get more people to administer the vaccines, more healthcare providers to administer the vaccines after hours, on the weekends, whenever. And they're trying to make sure that they set up new ways for people who can't get vaccines to get them. As many of you seen, the vaccine lines right now are quite long. So the demand is there. The supply is there as well. We just need to get more people to administer the vaccine so we can get more people to have it. No problem, Mark, anytime. Any other questions? Hey, Princess Lodge. People are elderly people, preconditions with hypertension, diabetes, and cancer survivor. That is a great question. So they did include older people in the Pfizer and Moderna trials. And they did find that while some older people did have some issues, obviously related to symptoms and side effects, they found that the majority of people, even if they were older and had these conditions, like Araceli mentioned, diabetes, hypertension, and cancer, they still were able to get the vaccine. And on the second dose, they may still have had those side effects, but they didn't have severe adverse reactions. Again, they kept that to a relatively low. But great question. And I think, what we're seeing in Norway, for example, where they say they've given the vaccine and then a few elderly people did pass away around 30. The healthcare providers found that there was actually these individuals were already older, already very frail. They were over the age of 75, have very serious conditions, and they weren't, and it was actually less than the mortality rate that Norway expects anyway. And what I mean by that is every week, Norway expects to lose around 400 elderly people because of the COVID pandemic. They lost around 30 who were vaccinated compared to 42,000 elderly people who were vaccinated. So yes, 30 sounds like a lot, but there were 42,000 elderly Norwegians who were vaccinated and did not have those adverse reactions. But that's a great question. Araceli, after 2 doses, if you still have antibodies in your system already, will your COVID test be positive? So the COVID viral test, the one where we all do the swab or the oral, that is a viral test. The PCR test is a viral test. You should not be positive. If you take the antibody test, which is when you have to give blood, you may be positive on that because your antibodies have been built up by the vaccine. You should not test positive on a viral test, which is what most of us are taking. Princess Care, Princess Home, Campbell Village, you guys are taking it every week. Those should still be negative. If they turn positive, the only way to confirm it's a false positive is for you to take another viral test. And you can go through your provider or you can go through your organization. But please let us know if you have any issues with that. ANX, we've been trying to do testing for some of our facilities, and please let us know if you have any other issues. But great question, Araceli. Mark, why do people who are infected still test positive for COVID viral tests? So Mark, this is a great question. And basically what happens is someone gets COVID-19, the virus is in their system, they get the symptoms. The virus then, after they start to get better because their immune system builds up the antibodies and basically eats away at the virus, the virus is still inside you. And what happens is called viral shedding, where the virus is no longer alive. COVID-19, the virus itself has passed away, it's dead inside you. But you still have remnants of the virus in you. So this viral shedding is what can lead people, even after they've recovered, even after they don't have symptoms, they can still test positive for COVID up to 3 months after they've originally had it. And that's why public health guidance, CDC guidance is if you test positive and you have symptoms, try not to test again until at least another month, because chances are you'll keep testing positive if the virus is shedding or dying inside you. Great question, Mark. No, thank you. You're making me blush. Any other questions? Any other questions at all? Are they still contagious? Mark, you're just on a roll. So people can still be contagious after 14 days. I want this to be clear. While the CDC guidance and public health experts say after 14 days, you can not quarantine, the caveat is you must not have symptoms. If you have symptoms after 14 days, you can still be contagious. So those symptoms need to be managed, and you need to make sure that they're managed without medication. So say, for example, you have a fever, you take something for the fever, Tylenol, you reduce the fever. Well, if you stop taking the Tylenol, you'll get the fever again. So if you don't have symptoms and you're not taking medication for the symptoms, it should be 14 days after your symptoms stop, after you've stopped taking the treatment and after your symptoms have abated. But yes, people can still be contagious up to 14 days if they're still having symptoms, because if people have compromised immune systems, the virus can still be inside them and alive. Great question, Mark. Yeah. Any other questions?
I think we have time for one more question. And if you guys want to send questions directly to Justin, his email address is here on the screen. You are also welcome to reach out to your ANX account executive directly for an in-service specific to your facility, if that's something that you guys want.
Okay, thank you, Justin. That was amazing. And I hope you guys found it informative. Again, as Christina said, reach out to us, the account executives and your contacts at ANX, and we will be happy to answer additional questions and concerns. Again, have a good afternoon. Justin, thank you. Great job. And thank you so much for attending, guys.